So we're going to talk briefly about eye diseases. Which would you rather, see well or look good? It's kind of a toss-up there, but I think I'd rather see well, wouldn't you? My grandmother used to say, "I'm not beautiful now, but I used to be," and that's more than most women can say. We all looked good once, didn't we? Sort of. We can look back to those days, but we all want to keep our vision as long as possible, both metaphorically and physically. You want to have good vision, that's for sure. So I studied into this. Cheryl told me I had to talk about vision to you tonight and eye diseases, and it's very interesting, the shifts that are taking place. It's sort of like with coronary artery disease. You ask someone, well, what causes heart attacks? Well, they say narrowed arteries, right? Oh, yeah, but what causes the narrowed arteries? And that's like glaucoma. What causes glaucoma? High intraocular pressure, right? High pressure in the eye. What causes that? Oh, well, we're not too sure. What causes that. But did you know that about 50% of people with glaucoma, depending on where you are, 30 to 50%, have normal pressure in their eyes? So how do you get glaucoma with normal pressure if high pressure is the problem? So it makes you step back and think, well, what really is going on? And what we find is that it's more complex than just high pressure in the eye. Now, if you have high pressure in the eye, there's no question that needs to be treated. But maybe there's something else going on besides high pressure. If you can get glaucoma without high pressure, it's got to be something other than high pressure. Makes sense, right? Well, first of all, what really is glaucoma? It's that you have nerves in the back of the eye. In fact, the eye itself is what? It's an extension of the brain, right? Because all the nerves in the back of the eye that you see with, they go right back through the optic nerve to the brain. And it's really connected very tightly. And so with glaucoma, what happens is those nerves begin to die. Well, why do they die? Good question. Why do they die? Well, where they exit the brain, if there is really increased pressure inside the eye, those nerves will get high pressure and they'll get pinched. And that happens. It's a mechanical thing to some extent. But what about the people with normal pressure? They can't get pinched mechanically, can they? And what we're finding with glaucoma and the other eye diseases is it's more complex than that. It's not only high pressure, but it's things like bad blood flow and things like too much inflammation too. For instance, diabetics have a markedly increased risk, about double the risk of glaucoma. Why? Well, because they have bad blood flow. You know, we've said several times in these lectures, perfect health is dependent upon perfect circulation. And that's true with the eye as well. They did some very interesting studies with glaucoma and found that you could supplement certain foods and you would markedly reduce the risk of progression of glaucoma. Now, I mentioned that with glaucoma you can have a normal pressure and get it. You can also have a high pressure in your eye and not have glaucoma. Isn't that interesting? So it isn't just pressure in the eye. It is pressure to some extent, but it's not the only thing, and that's really important to keep in mind. Well, let's look at some of the things to do to lower our risk of glaucoma and also treat it. And then we'll talk about the causes too. So under glaucoma, you'll see the first category is avoid. These things are all associated with increased risk of glaucoma. Obesity, particularly obesity with metabolic syndrome. Well, what's metabolic syndrome? That's a condition where your weight goes right around your middle here, and you put fat in your liver and in the intra-abdominal organs, and as a result of that, you have an increased risk for fatty liver, steatohepatitis it's called, and for diabetes. Because if you pack too much fat in the liver, it starts to fail. If you pack too much fat in the pancreas, it does as well. And we call that metabolic syndrome. And if you have obesity with that, your risk of glaucoma goes way up. Well, what's going on there? Well, we know with metabolic syndrome there's impaired blood flow, and there's marked increased levels of inflammation. So this is playing into the eye disease as well. Caffeine increases your risk of glaucoma. It's interesting that antioxidants, by and large, when we get them from our food, decrease the risk of glaucoma, and coffee actually is a good source of antioxidants. And so some studies have suggested maybe coffee would help glaucoma, but on the whole, it increases your risk, probably because of its effect on blood pressure. There's a transient rise in blood pressure and in intraocular pressure with caffeine. Alcohol also increases the risk for glaucoma, and that effect is probably because of inflammation. As you know, alcohol is an irritant. If you didn't know that, just cut yourself and pour some, you know, that 100 proof ethanol right onto that cut, and what does it feel like? Inflammatory, right? Well, it's inflammatory in the body generally, and that's why the risk of cancer goes up with alcohol, and the risk of glaucoma does as well. And then there's calcium and iron supplementation. You know, we talk about calcium and how important it is for our bones, but as I mentioned several times ago with a talk on osteoporosis, it doesn't really pan out that if you supplement calcium, you improve bone strength. And we're rethinking this whole thing about calcium supplementation. You do want to get enough calcium in your diet, no question, but we do know that excess calcium can cause problems, particularly with glaucoma. Calcium supplementation and iron supplementation both increase the risk of glaucoma. However, if you are on iron prescribed by a physician, that would indicate that you're iron deficient, and hopefully that was measured in your body before you were started on that supplement, and you need to take the iron if it's prescribed because you're iron deficient. But it's not a good idea to take iron if you're not iron deficient. Why is that? Not only for glaucoma, but iron is a pro-oxidant. It causes oxidation in the body. And if you take iron when you don't need it, you increase the inflammatory cascade in the body and cause lots of problems. The body's interesting. A good level is good, less is not good, and too much is not good. And when we need to keep that in mind. You don't want to think, well, if a little's good, a lot's better. That's not true, particularly when we're dealing with iron.
Can I ask a question?
Sure.
So you're talking about supplementation, but for food, like I'm thinking prunes. Like prunes are high in iron and calcium, right? So is that safe?
Okay, so what we found is when we're eating whole foods, we don't run into the same problem. And prunes aren't particularly high in iron. They do have iron in them. They do not have large amounts of calcium, but you're probably remembering the lecture I gave on osteoporosis. prunes markedly reduce your risk for osteoporosis, but that's because of their antioxidant effect. They are rich in antioxidants, and part of the reason we get osteoporosis is chronic inflammation. And so they're very effective at treating osteoporosis. Surprisingly, you hear about calcium and vitamin D over and over, and there's question whether they help or not, but prunes have been shown to definitely help reduce the risk of osteoporosis. So eat your prunes. And they won't hurt your eyes either. In fact, they're very good to lower the risk of eye diseases because of their effect on inflammation. And then excess glycation is involved as well. I've spoken of glycation many times. I'm just going to refer to it again because it's something that you really need to understand, particularly at Christmas time and at Halloween and at Easter, when all those sweets just kind of creep onto your plate. Glycation is a process first described in 1912 by a French chemist named Maillard, and it's called the Maillard reaction, whereby sugar attaches to protein or to fat in an irreversible manner. It also attaches to DNA. And when the sugar in our bodies, whether it's in the blood or in the tissue, is increased because we've eaten refined carbohydrates or sugar, when that happens, the rate of formation of bonds between proteins, fats, and DNA, that the rate at which those bonds form is increased. This reaction is completely dependent upon concentration. You increase the concentration of the sugar, you increase the glycation of those molecules. That glycation is irreversible. Once the protein or the fat has been glycated, it's glycated for the life of the protein. Now, we use that in diabetics all the time because we measure something called hemoglobin A1C. That's what percentage of your red blood cells are tagged with sugar, or the hemoglobin is tagged with sugar. We know that red blood cells live for 3 months. So if we measure the percentage of red cells that are tagged with sugar, we can tell you what your average blood sugar's been for the previous 3 months. We could measure that with the collagen in your body. But we don't do that because collagen turnover rates are much longer, a year or two or longer, and then I could only see my patients once a year instead of every 3 months. And what would I gain? I mean, we'd lose. So, but the important thing is when you tag that protein with sugar, you change its structure and function. The same occurs in the eye. It occurs with glaucoma. If you stiffen the structure of the eye, then you're going to have problems when it comes to the area where the optic nerve exits the eye. It'll be stiffer and it'll constrict the nerves that flow out there, the neurons that flow out through the optic nerve. And it tends to pinch them and it can cause cell death. There's glaucoma. Glaucoma is really death of nerves as they exit the eye. The nerves get traumatized either from increased pressure or from inflammation, and they die. And if you lose enough nerves, you get blind spots because those nerves aren't functioning anymore. And people with glaucoma will tell you, well, I can see around the periphery, or I can see here, but I have these spots that are just blurry and I can't see. That's because the nerves have died in the back of the eye, and so they're not working from these various causes. So those are things that you want to avoid: excess glycation, calcium, iron, unless they're prescribed by a physician, alcohol, caffeine, and obesity. What are some things that reduce your risk of glaucoma? Green leafy vegetables, particularly basil, parsley that we had in this soup, That's very good to prevent glaucoma and even treat it. Spinach and kale, why? They are very rich in lutein and zeaxanthin. These compounds are really important in the eye in multiple diseases, as you'll see. And if you have a family history of glaucoma, if you have diabetes, or are worried about your risk of glaucoma, make sure you have green leafy vegetables every day. And if you want to absorb that zeaxanthin and lutein more readily, you need to eat it with a little fat, because these are fat soluble and they're absorbed better if you have a little fat with them. Now, I'd recommend that you have them with seeds or nuts, and so put a little of that into your kale when you cook it, or you can have my wife's kale salad recipe if those of you were here for that. Once you eat it, you get addicted to it, it seems, and you want it more and more. But it has peanuts in it, or peanut butter, and that helps the absorption of the lutein and zeaxanthin. Another thing that really helps glaucoma and has even been shown to change the intraocular pressure is berries. Black currants have been studied the most, and there are several good studies on black currants showing that if you take black currants every day, the study that I looked at, they just took 1.5 ounces, which is like a tablespoon of black currants, and they gave that to subjects every day, and that lowered their intraocular pressure, and more importantly, it changed the course of the disease. Their eyesight was preserved, and that's really important. We know that you can lower intraocular pressure, and that will help, but it doesn't stop the illness. So you need to see your eye doctor. You need to have the high pressure treated if you have high pressure, but what if you have normal pressure glaucoma? Well, then you better think about these natural treatments. There are no side effects to them, and they can definitely help. Bilberries also help. Blueberries, we have those right here in Maine, lots of them, and they're rich in anthocyanins. Remember, I mentioned this onion has anthocyanins in. It has some, but not nearly as much as the black currants, bilberries, and blueberries. Another good source is cherries. The tart cherries or black cherries are very rich in anthocyanins. There's eggplant, the skin of the eggplant. You remember how deep purple that is? Those are anthocyanins. Purple cabbage, anthocyanins. That deep red pigment is really good for the eyes and will help you. Any questions on glaucoma? Yes?
Just wondered, when you were talking about the berries, how that fits in with, say, like a jelly or a jam, like black currant.
Okay, it's fine to have it as a jelly or jam except for glycation, right? Because you put all the sugar into the jam and the jelly, you push your blood sugar up, then you're going to have more glycation. There's nothing wrong with a bit of jelly provided you put it with some nut butter. That'll slow the absorption of the sugar. Put it on some whole grain bread and use a very little bit. Sugar's not a poison. Don't get the idea that it is. It is what our body runs on. The problem comes when you dump a whole lot of sugar into your body rapidly, and then the body doesn't handle it well, and the sugars go up. A normal blood sugar for most of us is around 100 or a little bit less, and that we need. If you don't have it, you run out of gas, so to speak, or you run out of... If you ask a diabetic who's on insulin, what does it feel like when your sugar drops? They just, they lose it. I've had patients sit on my exam table and just kind of fall over when their blood sugar drops into the 30s. And you run quickly and try to find something to feed them to get it back up. So sugar's not a poison, but if it gets to a high concentration, if you go up over 100, if you get up to 200, then your glycation goes way up. So you want to make sure that if you're eating sugar, it's with a whole meal with lots of fiber. Fiber slows down the absorption of the sugar, and so do natural fats like nuts and seeds. That slows it down as well. They're rich in fiber, and that fiber and fat, as it's packaged in nuts and seeds and avocados and olives, that keeps the sugar from soaring. Good question. Any others before we move on? Okay, the next topic there is macular degeneration. Macular degeneration occurs through loss of pigment in the eye, and that's because pigment protects the eye, doesn't it? And it also occurs from poor circulation. This is why diabetics have a little more macular degeneration as well. And it occurs from inflammation. That's why sunlight is a bad idea. Well, sunlight's good for us, isn't it? Yes, it is, but it's not good to look directly at the sun, is it? That's very damaging to the eyes. And if you have a history of macular degeneration, you may want to wear sunglasses when you're out in the bright light to protect your eyes from the oxidative influence of direct sunlight. Interestingly, these are the things you want to avoid to lower your risk of macular degeneration. I mentioned the first one, direct sunlight. Don't look at the sun by all means, not even during an eclipse. You want to avoid inactivity. We know that people that are very active have much lower risks of macular degeneration. You want to avoid smoking. Now, this is starting to sound like what? Any vascular disease, right? We say we want you to avoid inactivity and smoking and excess glycation and alcohol. All of these things increase your risk for macular degeneration. The macula in the eye is the area that you use for intense gaze. If I handed you the handout here and I said, I want you to look at it really closely, you're using the macula to focus down. That's your high focus area. And when you lose that, then you just have a little bit of peripheral vision, and in the center, when you try to look at something closely, it's just a blur. So macular degeneration is a real problem for us, and we'd like to avoid that. Now, with macular degeneration, the high pigmented foods are even more important than in the glaucoma, because it is the pigment layer in the back of the eye that protects the eye from damage from sunlight and other photostimuli that can be damaging to the retina. And it's really important with prevention of macular to get those deep green and deep yellow veggies that are rich in beta-carotene, lutein, and there it is again, zeaxanthin. All of these really help preventing macular degeneration. Now, some people have said, well, why don't we supplement? And there are quite a few supplements that ophthalmologists put people on. They do help some, but they're not nearly as helpful as getting the antioxidants in the food itself. One of the best articles published on that was actually published in the 1990s. It was a study out of Finland, and it wasn't looking at the eye, but it was looking at lung cancer. And at that time, they had a high rate of smoking in Finland, and they knew that people that had high levels of vitamin A and vitamin E in their body, in their blood, they had lower risk of lung cancer. So they put a large group of people on supplemented vitamin A and vitamin E and beta-carotene, and they thought, great, we're going to get these people to, you know, smoke and still have low risk of cancer. And what they found actually was if you supplemented with vitamin A or beta-carotene or vitamin E, the risk of lung cancer went up, not down. And they say, well, wait a minute. We know that if they get it in their food, the risk goes down, but if they get it in a pill, their risk goes up. The reason they think that happened is because there are over 600 different carotene-like compounds. They're called carotenoids. And if you take a high amount of one, you block the absorption of the others, and you may need some of those others. Food chemistry is incredibly complex, and when we supplement one thing, we often make the person worse, not better. And that's certainly true with lung cancer. We've proven that, and it looks to be true with the eyes as well. You're far better off to get these substances in the food as nature presents them to you rather than in a pill form. So I would encourage you to eat those deep greens and deep yellow veggies to protect your eyes. And you need to get them on a regular basis, not just once a month, because these pigments don't stay around forever. They need to be replaced in the eyes to protect the eyes from damage from oxidation. And as I said there, increase exercise. The better your blood flow, the less problems you're going to have with macular degeneration. Any questions on macular? Yes. Oh, I like questions.
So I wanted to ask about the sunlight, not looking at the sun. So I had read that for your circadian rhythm in the morning, early morning, that it's a good idea to get outside and get direct sun and not wear your sunglasses. Because something about the vitamin D in the eyes.
Yeah, so sunlight is one of the best things we can expose our bodies to. In fact, there's a lot of research out recently on COVID and sunlight exposure. And if you look at Europe, which you go all the way from the southern climes of southern Italy up to, you know, the northern Norway and Denmark, you can track that right along with the sunlight exposure. They lost it first in the north, and they got COVID. And then as the season changed, they got a little further south and a little further south and a little further south, and Italy was the last one to get the boom of COVID. Why? We thought it was vitamin D. It wasn't. It was exposure to near-infrared light. And near-infrared light, you know you're getting from the sun when you can feel its warmth. It goes right through your clothes. You don't have to go out half naked to get the benefit from the sun of near-infrared light. Lynn and I were out walking, was it Sunday? It was so nice and sunny, and it was cold, but you could feel the warmth on your face, and when you can feel that, you're getting near-infrared light. Near-infrared light stimulates the production of melatonin in the mitochondria in the cells, and melatonin not only helps us sleep at night, but it's one of the most powerful antioxidants in the body. And it reduces inflammation, and it improves our immune system function and reduces the risk of developing COVID in the first place and getting severe COVID in the second place. So that's just one incidence of why sunshine is so very important for us. It's really important for our immune system. It's important for vitamin D production, although you don't make vitamin D in Maine this time of year. That's ultraviolet light, not near infrared, and the angle of the sun in the winter here is not steep enough to give us enough ultraviolet to make vitamin D. Wait until March, and then you'll be getting vitamin D again, and I'd encourage you to get out, get lots of sunlight, but don't get a burn, because if you get a burn, then your cancer risk goes up, and we don't want that for sure. Lynn?
I was thinking that her question probably was referencing how to balance the realization that sun is really good for us with if you were concerned about macular degeneration.
So I think sunglasses can still be worn because they don't cover a whole lot of your face. The rest of your body, your arms, when you're out and it's not too cold, get some sunshine. Don't think you're going to get vitamin D now, because you don't, but you will get near infrared, and you get that right through your clothes. You can get it, if you feel the warmth from the sun, you're getting near infrared. And that's the important thing there. Yes, question?
So, this time of year, a lot of people, including myself, have one of those lights that you do in the morning, you sit under it for
right.
about half an hour, and that really helps you.
That helps depression,
Yes.
and it also helps with the circadian rhythm. No question about that. You're not going to get near infrared from that. If you want infrared, you can buy an infrared light, and you do get it from that, or you get it from sitting in front of your fireplace or your stove if you have a window. If you can feel the heat and see the light, I mean, there are different kinds of heat, but infrared light, you have to see it and feel the heat. Then you're getting that near infrared, and that also will help with the production of melatonin in the mitochondria. We hear about the pineal gland and melatonin production there, which helps us sleep, but this is intracellularly from the sun. Yeah. But no problem with using a light box for depression and circadian rhythm. That's fine. It's a different wavelength. Okay. Any other questions? We'll move on to cataracts. Okay, cataracts. What happens to form a cataract? What is a cataract? Well, you've got the cornea. Is a cataract in the cornea? No. What's behind the cornea? The iris. Is the cataract in the iris? No. What's behind the iris? The lens. And if you have cataract surgery, what do? Well, they make a little slit here, and they go behind, and they pull out your lens and put in a new lens, a synthetic lens that you can see through, because you can't see through a cataract. Well, what's happened to the lens that made it cloudy? It's been glycated. That is, sugar has attached to the protein in the lens, and when it does, it gets cloudy and you can't see through it. That's why diabetics are at much higher risk of cataracts. Now, you can get that cataract replaced. I mean, you can take out the old lens and put in a new one, but what happens when you do that? You're going to get more macular degeneration. Why? Because that cataract was formed from not only glycation, but excess sun exposure. And now it's really the body's way of defending the retina. And we know that if you get a lens implant, you're going to have a higher risk of macular degeneration. That's not to say you shouldn't get a lens implant, because if you have cataracts and can't see, you need to see. But I would recommend that if you have a lens replacement, you do wear sunglasses to protect your retina from the excess sun exposure that can cause macular degeneration. See, the body wants to care for itself, but sometimes it gets a little out of balance because of things we eat or because of the parents we chose. Yeah, you got to choose your parents carefully. And so it's important with cataracts to say, all right, I have a family history of those, or I know I may be developing one. What can I do? Well, one is cut down on sugar, and you'll see that there. Avoid excess glycation. Avoid direct sunlight. Avoid smoking. That increases inflammation, and inflammation increases glycation and causes problems. There's a study at the bottom I thought you'd find interesting. This is from the May 2011 American Journal of Clinical Nutrition. And they showed that if you're a high meat eater, you have the highest risk of getting cataracts. And if you eat less, you have a lower risk. And if you eat less, lower. If you're a vegetarian, lower. If you're a vegan, you're at the lowest risk. The less animal flesh you eat, the less risk of cataracts. And it's a marked reduction from if you're a low meat eater, you have 0.96 chance, or you decrease your risk 4%. If you're a vegetarian, it goes down to about 30% reduction. And if you're a vegan, you drop the risk by 40% of cataracts. Interesting. Just that one thing. Now, if you're a vegan and didn't stare at the sun and wore sunglasses when you were outside and you ate all that fruits and veggies and whole grains, you might get all the way to 90 without needing your cataracts done, or maybe you'd make it all the way. So there are some things that you can do that are simple to help protect your eyes, and I'd really encourage you to do that. Any questions that you have? Yes?
Is there any relationship between floaters on the eyes and any of these conditions?
Not directly, no. Floaters have to do with the gel, if you will, inside the eye and how it develops and whether you have trauma to the eye or not. That's a little more complex, but it does have to do with inflammation as well. And so you'll have less problem with that if you are on a high antioxidant plant-based diet. The more colorful the food, the more antioxidant rich it is. And so you want to, for your eyes, eat the rainbow. You want to see the rainbow, eat the rainbow. That's really the sort of the summary of how to protect your vision. Yeah. Simple, but very effective. And don't forget that study on black currants and glaucoma. Really amazing what a small amount of a medication did to change the whole course. Jane, you had a question.
Was that 1.5?
Ounces. Yeah, it's just a small amount of black currants. Blueberries work, bilberries work, but the study was done with black currants.
One of the things that I appreciate about this lecture series, and Dr. Howe in particular, is so much of what we talk about, frankly, is the same thing. With all of these different ailments, with all of these different diseases, with all of these different chronic situations,
Same answer.
It's the same answer. And
Same
who would have
answer.
thought that the same answer would have been true for your eye?
Yeah.
Thank you for coming. We look forward to seeing you next month. Have a good evening.